Improving neonate health with early initiation of pumping in postpartum mothers. Nursing staff can and should provide support to breastfeeding mothers during their hospital stay by educating their patients on the benefits of human breast milk to improve the health of their neonate. Nurses can provide early intervention, especially initiation of pumping with hospital-grade electric breast pumps to initiate milk supply in postpartum patients who are not able to put their infants to breast. According to Spatz et al., 2015, human breast milk is the favored form of nutrition for all neonates and infants. In some instances, neonates are born with medical conditions that require separation from their mothers at delivery. For those infants, it is important to initiate pumping so that can have a positive impact on their long-term health and prevent further health complications such as sepsis, necrotizing enterocolitis, and it can prevent many other types of infections. Learning objectives for this project are that nurses will be able to demonstrate proper setup of a hospital-grade Medela breast pump. Nurses will be able to discuss reasons for early initiation of pumping for postpartum mothers. Nurses will be able to educate postpartum patients on the benefits of pumping for her newborn, and nurses will be able to instruct postpartum patients on setup and maintenance of the hospital pump. Project outcomes include 95% of the nursing staff on the mother-baby unit will successfully demonstrate correct setup of a hospital-grade electric breast pump. The project will produce an increase in the number of postpartum patients who use breast pumps when separated from their neonates by using a breastfeeding audit tool to determine that these numbers have increased. An increase in the number of nursing staff who are capable of providing adequate breastfeeding support in addition to the certified lactation staff on the unit, and that postpartum patients will be surveyed over a 6-month period following the project to illustrate an overall increase in postpartum patient breastfeeding support satisfaction. Teaching strategies utilized for this project include a demonstration, return demonstration, and lecture to accomplish the learning objectives. According to Bastable 2019, demonstration and return demonstration are useful strategies in teaching a specific skill. The educator can determine the skill of setting up a breast pump to the nursing staff and evaluate their learning as they perform a return demonstration. The lecture portion will provide evidence-based knowledge to the nursing staff on the importance of pumping for mothers who are separated from their neonates. Utilizing teaching methods that combine cognitive and psychomotor domains will appeal to the different learning styles of the nursing staff. The next few slides will demonstrate the step-by-step instructions to setting up a Medela breast pump. The following supplies will be needed in order for the nurse to set up the patient with a breast pump: electric breast pump, Medela brand, pump supply kit, liquid dish soap, breastfeeding information packet, and lanolin cream. The following instructions are taken from the Medela website for manufacturer instructions on how to set up a Symphony breast pump. Wash hands prior to setting up breast pump. Gather breastfeeding supply kit and pump as soon as possible, preferably within 6 hours of delivery. Open breastfeeding kit and connect breast shields to connectors. Check size of shield and compare to get correct size needed for the patient. Each kit comes equipped with 24mm and 27mm shields. Connect yellow valves and white membranes to bottom of each connector. Make sure they are in a lateral position. Screw colostrum collectors onto bottom of connectors. Connect tubing to back of each connector. Next, connect other end of tubing adapter to each membrane cap. Open top of Symphony pump and then place each membrane cap onto top of pump until flush and top clicks when closed. Turn on pump and use the Initiate program to start for mothers who are dependent on the pump for stimulation. The Maintain program can be used in mothers who have established lactation and want to grow their supply. Mothers should pump for 15 to 20 minutes every 2 to 3 hours. Encourage mothers to use lanolin cream after each pumping session to reduce soreness. All connectors, valves, membranes, bottles, and shields should be washed in warm water with dish soap and placed on a clean surface to dry after each use. It is important that nurses understand their role when assisting postpartum mothers. Set up the breast pump if indicated by lactation staff or the current hospital policy. Provide support when patient rounding and is needed if patient requires further support. Listen to mom and address any concerns or questions she may have about the pump or her current plan of care. Encourage mother to pump consistently every 2 to 3 hours, even at night, at least 2 times when prolactin levels are higher. Assist in labeling breast milk per hospital protocol, and educate mothers on maintenance and storage of breast milk following discharge. My name is Katie Hollifield, and this concludes my presentation on improving neonate health with early initiation of pumping in postpartum mothers. Thank you.